Hello, I'm Beth Britton. I support Dementia Community with their communications work. Welcome and thank you for joining us for today's webinar, Transforming Mouth Care Challenges into Success. Before I introduce you to our presenter, I wanted to briefly explain a little more about Dementia Community. Dementia Community is a charitable community benefit society, a membership cooperative that provides learning and networking opportunities for the dementia care community. We are an independent voice and inclusive organisation aiming to help all of our members to feel connected, informed, inspired, empowered, purposeful and engaged in co-produced changes that improves everyone's experience of dementia, both in care and in wider society. This webinar is just one example of the many ways in which we do this. Community members own a £1 community share in Dementia Community and membership is open to everyone. So if you aren't already a member, do join us. You can use the QR code on your screen or the link in the chat to visit our membership page. If you're having any difficulties in joining Dementia Community, please do message me and I will try to help. I also have some notices to share with you. So the first one is about our next in-person event, which is the UK Dementia Awards. Now, my key question for you is, have you nominated yet? If you haven't, please do. We have 15 fantastic awards up for grabs, and we would love to hear about amazing individuals, teams, and organisations who deserve recognition. Please use the QR code on the screen or the link in the chat to find out more. Nominations close at 5 p.m. on Friday, the 27th of February, 2026. The Gala Awards lunch and ceremony is at Combe Abbey in Warwickshire on Thursday, the 30th of April, 2026, and is not to be missed. Next, I'd like to signpost to our latest editor's pick from the Journal of Dementia Care. This is a free article chosen monthly by the JDC editor, shared to give you a taste of the content of the journal. Please use the QR code on the screen or the link in the chat to read the article. Remember, if you are a member, one of your benefits is a 25% discount on a subscription to JDC. So if you enjoy the editor's pick, do subscribe. And then finally, a thank you to the Unforgettable Foundation, who have kindly set up a GoFundMe page for Dementia Community's webinar programme. Our webinars are free to attend, and we want to keep them this way to ensure access for everyone. But providing them does have cost implications for Dementia Community. This fundraiser is intended to help meet those costs, and if you would like to donate, please use the QR code on your screen or the link in the chat. Thank you. Now, just before we begin the presentation, just a couple of housekeeping things to share with you. As you should already have been alerted to by Zoom, we are recording this webinar. Please use the chat for your questions. We will have a Q&A and discussion after the presentation, and we'll be keeping an eye on the chat. Afterwards, the recording of the webinar will go onto our YouTube channel, Dementia Community. So let me introduce you to our presenter. So Jane Peterson is a dental hygienist with a special interest in mouth care for the elderly. She is founder of Knowledge Oral Healthcare. Jane, thank you so much for joining us. Really looking forward to this afternoon, and over to you.
Lovely, thank you. So do you want me to get my slides up? Oh, yeah. Now. Right, okay. So good afternoon, everyone. So as Beth said, I'm a dental hygienist, and just a very, very quick intro about me before I start the slides is I've been going into care homes since 2015 after interviewing care staff to find out how they find mouth care, attending to people's mouths. Definitely not everyone's cup of tea, that's certainly for sure. And for me, I thought it was a really straightforward thing to do, you know, brushing clean teeth. But clearly not, and especially when you have people that are resisting mouth care. You know, as people advance with dementia, they do become more resistant to general sort of personal care, and obviously mouth care is one of them. And I certainly wasn't geared up for it, that's for sure. You know, I hadn't been on all of these 15 years ago anyway, been on dementia courses, etc. And I certainly learnt a lot. And I would say that we deliver oral care training and oral care service to care homes. But we really do emphasize the dementia aspect to it because it is quite tricky. So I'm hopefully there's going to be lots of tips and things for you to that will help you with regards to people with dementia. So let's move this over here 2 seconds. So as it says here, good mouth care, so good mouth and teeth care is important for people living with dementia because they are at higher risk of dental problems, as in, decay and gum disease. And they may find it difficult to report pain or discomfort because of, communication, etc. Poor oral health not only influences physical health, as in, with regards to eating, but also impacts on self-esteem, dignity, nutrition, and quality of life. So it needs to be taken seriously. Now, this in the Portsmouth University paper, they interviewed carers, um, home care workers, and home care managers, and highlighted challenges in delivering oral care. Right. And these include factors related to the person living with dementia. And they said such as declining understanding, memory problems, and physical disability. So people with dementia often have more plaque on their teeth. Um, People with dementia often have more plaque on their teeth because brushing becomes harder as memory, understanding, and physical ability declines. As the condition progresses, many people need help with daily mouth care. And such studies have shown that those with moderate to severe dementia have twice as much plaque on their teeth compared to those without dementia. So on that note, as you can see, we all generate plaque, okay, whether we eat or not. And I'm just going to get a poll up here because it's quite well, I find I think it's an important thing. So can you see this poll here? What do you think plaque is? So do you think plaque is food, bacteria, saliva, mucus, or all of the above? So if you can, people could just log onto the poll, I'll give you. Right. Okay.
Got a lot of people going
You've
for
all
all of the
answered.
above.
Yeah. So basically, well, 87% have said all of the above, and 7 of you have said it's bacteria. Lovely. I'm going to end the poll there. So it's the majority of you said it's all of the above, as in, food, mucus, all of that. Well, basically, you can starve yourself for a whole week and you'll still generate plaque. Plaque, essentially, all plaque is bacteria. So let me just explain something. So hopefully you've all brushed your teeth this morning. I'm sure you all have. So you brush your teeth, and literally 3 to 4 hours after brushing your teeth, you will start generating plaque. So plaque basically is bacteria. You've got the mucousy, slimy stuff from your saliva. It's called the pseudomembrane or the biopellicle. You need to remember that. But that slimy stuff on the saliva slits around the neck of the teeth. You've always got bacteria in your mouth, be it good or bad bacteria, and it sticks to that slough. That is the matrix of plaque, basically. Now, if you eat foods that contain sugar, then the consistency becomes thicker and so it matures. But essentially, you can starve yourself for a whole week and you'll still generate plaque. You can have somebody that's meal by mouth, that's peg fed, and they'll still generate plaque whether they eat or not. So when you go to bed at night, you brush your teeth. And then in the morning, you have bacteria in your mouth. You're starting to build plaque up. And that's why you brush your teeth in the morning. So this is why we brush our teeth twice a day. So essentially, that white sticky stuff, if you swipe that and put it under a microscope, it's just generally bacteria. Okay. So, and it sits around the neck of the tooth. That's where that plaque sits around. So just to highlight this as well, gingivitis is bleeding gums, inflamed gums. So if you're assisting someone or you've got a member who has dementia or whoever, it doesn't matter who they are, if they spit in the sink and there's blood there, that is an indication that the gums are inflamed. They've got gum disease, basically. Healthy gums don't bleed. So if plaque is not removed from the teeth, after a few days, it will irritate the gums and cause the gums to become inflamed. And it literally takes 2 to 3 days for that to happen. So the gingivae is the gum, and itis just means inflamed. So it's inflamed gums. So there's a few things that you need to remember is healthy gums don't bleed. The more the gums bleed, the more inflamed they are, basically, and it's totally reversible. So if you just persevere with brushing, you'll clear the inflammation up. So if you're brushing your teeth and you miss a little area for 2 or 3 days, if you go back to brushing that area, you'll notice it's still sore and the gums will bleed. If you persevere with brushing and remove the pores, the plaque, you'll clear the inflammation. They'll stop bleeding literally within a few days. So it's totally reversible. The other thing before I carry on is if you notice an odor in someone's mouth, what happens is the plaque isn't removed, the bacteria breaks down, gives off what we call volatile sulfur compounds, which is an odor in the mouth. So people with dementia have a significantly higher rate of dental caries, tooth decay, than those without cognitive impairment. So reasons include, reduced ability to perform oral hygiene, reliance on caregivers for mouth care, dietary changes. They tend to have a higher sugar content, just maybe to encourage them to eat, or a natural fact as we get older, taste buds change. We tend to want more sweet things. Xerostomia, which is basically dry mouth. If you've got a lack of saliva, everything sticks to the teeth. You're more likely to get rampant decay. And also saliva, you've got antibodies and the washing effect of saliva as well. And behavioral challenges. So many people living with dementia are able to look after themselves. As dementia progresses, their family or home care workers are likely to help the person care. This might include reminding the person to clean their teeth, or take care of their dentures. If people living with dementia cannot care for their teeth or mouth, they may be in pain or they may have problems eating and may need treatment. So, to be honest with you, you see this teeth sort of broken right down at gum level. This is not actually that uncommon to see. As mouth care declines, the teeth get so decayed they break down at gum level. Not an uncommon sight. Problems is, going to the dentist. There's challenges there with, access. The dentist getting access to the person's mouth, etc. We can talk about that later. With regards to general mouth care, plaque will stick to any hard surface. So it will stick to enamel. If someone doesn't have teeth and they have dentures, full dentures, plaque will still stick to the dentures. It's a hard surface. So they still need to be cleaned. So plaque should be removed from the teeth twice a day. The most effective tool for mouth care is this, basically. Oh, you can't see that. Is a toothbrush. Okay. It's the mechanical removal of plaque with a toothbrush. So what I'm trying to say here is using something like a mouthwash isn't going to do it. A mouthwash isn't going to physically remove anything. Yes, it's got an antibacterial ingredient in it, but don't rely on a mouthwash. It's what you physically do with a toothbrush. Okay, so the overall goal is to achieve and maintain good oral hygiene as follows. So you need to clean all the teeth surfaces. Remember the gum, the plaque sits along the neck of the tooth. So if you're assisting someone with toothbrush, and we'll talk about trying to keep people as independent with mouth care in a minute. But if you do happen to be assisting, or maybe you're guiding them with toothbrushing, we'll get to that, don't worry. What you want to do is you want to angle the bristles of the gum margin, so the part sits around the neck of the teeth. So you don't want to just be brushing the teeth, you want to angle it, the bristles right down by the neck of the teeth, and obviously applies to an electric toothbrush. Two, the gold standard or best practice is to spit the toothpaste out. You want to leave that toothpaste in the mouth for as long as possible. So most toothpaste contain fluoride. And fluoride helps strengthen the enamel, helps harden the enamel. Okay, so if you're just rinsing the mouth out, all the fluoride disappears from the mouth. So you want to keep that fluoride in the mouth for as long as possible. Okay, so ideally that's what you want to do. Get them to spit and not rinse out. Uh, Mouth, with regards to tools, so you want small, we'll go into the next slide a bit more, but you want a small headed soft bristle brush, mild non-foaming toothpaste. Um, I'm not, if you're assisting someone, I'm not so concerned about cleaning in between the teeth so much. You may want to consider dry mouth products if someone's got a dry mouth. And then you've got denture cleaning pot and fixative if that is needed. So toothpaste, always getting asked, what toothpaste? What's the best toothpaste on the market? There isn't one. So honestly, I just go to somewhere and just get a branded toothpaste, something that's cheap. You want to go for something that is mild in non-foaming. So you've got the foaming agent in a toothpaste tends to dry the mouth out, and it's just there for a feel-good factor, basically. So the sodium lauryl sulfate does have a drying effect. Also, the whitening toothpaste, the same kind of thing. They just temporarily dehydrate the enamel with the toothpaste to their natural colour again. So it tends to have a drying effect on the mouth. And a lot of people with, especially on a lot of medication, may have a dry mouth. So um, go for, I mean, Colgate, Sensodyne, kids' toothpaste, Orally, Aldi's, something their toothpaste is really mild, so something like that anyway. With regards to toothbrushes, what you want to look for is the smaller the head of the toothbrush, the better. Most people tend to go for a great big large head, and the shops will stock what's going to sell. So if you've got a smaller head, you're going to get further to the back on the inside. Um, and you see a lot of these toothbrushes have these colours on them, these are colour indicators. When this colour fades, you need to replace the toothbrush. I mean, it's recommended every 3 months, but you're hardly going to put, you bought a toothbrush in January, you need to replace it in the April or something. So, or if the toothbrush, the bristles splay out, it's completely useless. It's not going to be doing that much. So small, and you'll notice with the electric toothbrushes how small the heads are for that reason. You've got further to back on the inside, larger head, you'll miss areas. Um, so small head. I'm just going to, so yeah, just let me just this one here again. So when you're brushing, if you are assisting someone, you want to start with the outer surfaces first. These are the easiest surfaces to get to, okay? The outer surfaces. Then you've got the biting surfaces, and then you've got the inner surfaces. Now, you may find that somebody benches down on the toothbrush, and we'll talk about that in 2 secs, okay? The outer surfaces, although they're the easy surfaces, they tend to have more plaques sticking to them. And then if you can get on the inside ones, then great. I mean, ideally brush all surfaces, but start with the outer ones first. You may find somebody purses down, and again, we'll talk about that in 2 secs. Now, I just wanted to, I couldn't talk about mouth care without putting Sterodent tablets and things. So if you are using, well, anyway, denture cleaning solutions and tablets, some people just swear by a denture cleaning tablet, and I'll put in Sterodent there. A lot of these denture cleaning tablets and solutions contain something called sulfate. Now, sulfate is brilliant for cleaning dentures. However, they're a health hazard. So if you have somebody eating or ingesting basically a Sterodent or a denture cleaning tablet or solution, there have been fatalities. Now, with regards to care homes, if anyone is from a care home, all the CQC inspectors were told about an incident. There was a chap with dementia who went into someone else's room and mistook a Sterodent for a mint. And he was found foaming at the mouth in the corridor. Now, the carer, with all good intentions, gave that gentleman some water, which exacerbated the situation, and there ended up being a fatality. And all the inspectors were told about this. So if you really, really want to use it, it really needs to be locked away. That's arm's worth to reach, you know. The other thing that I wanted to add to that is there, if you read on the instructions, it says to soak for 3 minutes. There's nothing on there about soaking overnight. Orphans that make the dentures hate the stuff, purely because they wet the denture. So it bleaches the denture, and if you keep using it over time, the denture, the acrylic becomes porous, becomes white and frosty, and it's more likely to fracture and break. So cleaning dentures, just like teeth, you can just literally, with a toothbrush and mild soap, you can actually, clean them with a toothbrush and mild soap, rinse them under water, and just store the denture dry in a named pot. Okay, so I thought I'd add that one on there. Mm. So, tips and coping strategies for people that resist healthcare. And as I've said, as people advance with dementia, they often become more resistant to personal care. Why do people resist? Well, there's actually particular structures in the brain, the amygdala pathway, that deteriorates and subjects the fear response, causing people to become threatened to non-threatening, what normally non-threatening situations. And mouth care is one of them. So when someone is exhibiting behaviour such as fighting, shouting, pushing, whatever the situation is, it's a genuine fear response. They go into the fight or flight response. Okay, so it's a genuine fear response where the heart is elevated and they with the spiral, that kind of scenario. Um, so very, very interesting. They found that facial expressions can provoke fear. So people with dementia lose the ability to differentiate facial expressions. So this means that they're neutral, sad, angry, frustrated, and surprised faces are typically categorized as fearful. And they did a study and they found that if a caregiver is relaxed and smiling, people with dementia are less likely to evoke problematic behavior. Um, I've got here. Resistance is most likely to occur when a carer is providing physical assistance rather than allowing the resident or that person to perform their own care. So studies have showed that resistant behaviour was most likely to occur when a carer was invading their personal space, which makes sense, bathing, mouth care, etc., which is fairly invasive, I guess. So triggers to cause assault. Quite an interesting one. Well, I had to really look into this one a bit more, actually, I'll be honest with you. So the first one on the top of the list was the biggest trigger was calling the person by name, which I thought was quite interesting. So calling the person by name was among the highest ranked caregiver behaviour to trigger physical assault. Now, fear learning often takes the form of Pavlov's conditioning. So what's happening here is if you're using somebody's name whilst you're giving personal care, so you're doing something they don't like, basically. So if you're Mary, come on, Mary, and see you splash cold water in their face, or whatever the case is, they're linking their name to the scenario they don't like. So by pairing hearing, such as using the person's name whilst doing something noxious, as having water unpleasantly splashed on the face or an intrusive touch, results in fear memories. So that's where that comes from. The other one, so just be very mindful, basically, when you're using somebody's name, when you're giving kind of, mouth care or personal care, I guess. Do not use baby talk. They said using infantilizing terms such as baby, honey, dearie. They say it's a dehumanizing approach and is documented to trigger resistant behavior. I think it's how you say it, maybe, really. Attempting to forcefully insert the toothbrush into someone's mouth without alerting them first would kind of make sense. Lack of praise or encouragement. Attempting to provide mouth care without prompts or gestures. And the NHS Mouthcare Matters, they do videos on this sort of, doing a prompt, on the back of your hand or their hand before you carry out mouth care. So they, to see what you're going to do. Also, giving multiple commands rather than simple steps um, can cause a bit of anxiety there. Basic approach. Think about your tone of voice, expression, and grip. Use visual cues, like I've just said to you, using the back of your hands, such as gestures, hand gestures, and demonstration and less talking. Actually, I had a gentleman last week. Okay. He really, well, he thought I was a dentist for a start, which probably didn't help. But he thought, "Oh, you're going to hurt me." And that, just showed him with a toothbrush on the back of his hand, and he was fine. Gradually building up trust. Okay. So, having that teeth brushed, breaking down the task. So it's you may need to wipe the slate clean with someone, or if you are in a home and I don't know what, depending on what care setting you're in, or maybe you're home with someone. Um, just build things up slowly. You don't need to do the whole mouth in one go if that is not, if that's going to be too much for them. So maybe all you do is you just brush the front of the teeth and that's all you do. Or maybe you just brush one side of the mouth and that's all you do for that day, for example. And maybe the next day you brush the other side of the mouth. You're building up trust, or they're building up trust to you. Okay. Um, speak loudly and clearly, use simple vocabulary. Talk to the person at eye level or within their visual field. This is quite so. Okay, so approach the person side on. So people with dementia will have diminishing peripheral vision. So in later stages, the sight becomes monocular. They can only see what's just in front of them. So if you approach somebody face on, it can be quite confrontational. So you want to approach somebody from the side. And the other thing is, before you carry out mouth care, if you are assisting someone, is to give a reassuring touch. So they don't know where you are if someone is advancing with dementia. So reassuring, so they know where you are. So you well, hi Mary, it's Jane. We're going to get mouth care, brush your teeth. So then when you come towards that person, what you want to do is you want to put your hand on their shoulder or their knee, so they know where you are. And then what I tend to do is I tend to stroke the jaw cheek area again so they know where I am. And then what I'll do is I'll put the bristles on their lips again, the memory prompt before I start carrying out mouth care so they know where you are at all times. Because if you just appear from nowhere and the next thing you're there with a toothbrush, that can be quite alarming for them, for a person. Um, Having a sense of control. This is caring for smiles, NHS caring for smiles. This is all about giving them a sense of control. Okay, so they feel that they're less likely to resist if they have someone with dementia has a sense of control. So you've got things like bridging and chaining. So bridging is follow the leader, basically. So they've got a toothbrush and you've got a toothbrush. Okay, they've got full sense of control. So they're basically brushing their teeth, but they're copying you or they're mirroring you. Then you have chaining. So chaining is that person's got a toothbrush themselves. You've got your hand over theirs, so you're guiding them. Okay, with the toothbrushing. Then, if they can, you let go and they continue brushing. If that isn't the case, that's literally hand over hand. Yeah, with the toothbrushing. You could use hand over hand in actual fact for removing dentures. So that is if you're removing dentures and maybe if you are in a home, that is, and you don't want to put your fingers in someone's mouth, sort of partial denture, you can actually use their hands. So their finger goes in their mouth to remove the clip. So it's hand over their hand. Um, Actually, a little tip to just quickly while I'm on the subject of removing dentures is if somebody's got a full denture, the best thing to do is to put your finger on the top of the denture. It's held in by suction. It's to be firm and quick to pull the denture out and quickly remove the denture. If you take your time, that's when the mouth sort of closes in. And the lips are very strong. The muscles around the cheek and lips are very, very strong. Distracting is a proven distraction technique. There's a video called Mouth Care Without a Battle by University of Carolina. They go into a home and it's a dementia home. They bring out mouth care and the different tips. It's really, really good, cool technique tips there. And they get the residents to sing, all talk, have a conversation, and they get, try and get there and do as much toothbrushing as they possibly can. It's just a distraction. Or I'll go in and maybe the television will be just a distraction again for them. This one here, if anyone's heard of Keeper Snow, if ever you get to go on any of her courses, she's a bit of a dementia guru. Probably, I'm sure you've heard about it. With regards to mouth care, I mean, there isn't one thing that works for everyone, unfortunately. It's a bit trial and error, really. And it's going through the different tips and, like I said, strategies. Her one's quite a good one. And it's the underhand technique. So what she says is you stand to the dominant side of someone. So, find out if they're right, left-handed. So if they're right-handed, you stand on the right-hand side. Now, the reason being is this is where all the history from fine motor skills and automatic behavior is. So you stand on their dominant side. They'll also look and pay more attention if you're on their dominant side. So you are going to be holding the toothbrush, okay, and you're going to be doing the toothbrushing. However, that person is going to feel like they're brushing their own teeth. They're going to have their hand over yours, okay, like in that picture, okay. So they feel like they're brushing their own teeth. Now, with your other hand, what you're doing is you're going to place it down on their shoulder. So this is a pure distraction. So they're thinking less about their mouth, more about their shoulder. So you just literally push down on their shoulder. You are going to be doing the toothbrushing. So try that one. Very, very simple, and it's actually quite effective, that one. We have, if someone refuses to open. So if be reassuring, say what you're going to do before you do. Actually, something. The other thing is giving the reason is a very good one as well. Like, oh, I can see something in your mouth, or you brush your teeth, you still make your mouth feel all nice and fresh. As it says here, get the person to sing as this helps open the mouth. The other one, this is quite a good one as well. If you stroke the side of the teeth, and they do this for newborn babies, it's a reflex, natural reflex to relax the jaw and it opens the mouth, for babies breastfeeding. But you can try it. It's quite a good one. If you stroke the side of the cheek, this helps relax the jaw and encourages them to open their mouth. Just by touching the mouth or teeth gently with the bristles can be a prompt. The other thing is if you have someone that is pursing their lips, coming from that toothbrush. So if you have someone that's pursing their lips, that doesn't necessarily mean they don't want their teeth brushed. It could just be that they don't understand what you're doing. I had that with my mum. Actually, my mum had dementia, and the staff said to me, "Oh, your mum doesn't want her teeth brushed." Okay, well, actually, she's doing that to the toothbrush. The thing is, she wasn't pushing away. She wasn't resisting and doing anything like that. She was just pursing her lips. So back to the toothbrush, roll it round. You can usually get in there, start brushing the outer surfaces. Now, as soon as you start doing that, 9 times out of 10, the person will open their mouth. Okay. But you can usually, if they're clenching, you can usually just at least brush the outer surfaces, if nothing else. Or if they will not open, then with a smile, you'll come back later. Biting the toothbrush is quite a common one. Okay, so if you're going round, somebody clenches on the toothbrush. What you do is bite down on the toothbrush. What you do is you leave the toothbrush in the mouth. Okay? Then you get another toothbrush. And you can at least brush the outer surfaces. Actually, I'm right-handed as to the other side. You can at least brush the outer surfaces. And again, the thing was, you're doing that, the mouth is ajar, and it should be easier than someone tension right down anyway. When you need to release the toothbrush, what you want to do is, again, if you rub the jaw area, the jaw will eventually it will relax, and that person will open their mouth. Okay. If you know that person is going to just clench down as soon as you get anywhere near the mouth, they just clench down on the toothbrush. Then what you can do, because so many times we get asked whether we can post out dental bite props. You know, when you have a filling, you have a prop put in your mouth to keep the mouth open. You don't want that. It's far too, yeah, anyway, it's far too wide. You don't want something like that. All you do is, again, two toothbrushes. This isn't ideal, actually. You'd be better having one that is flat. But anyway, back of the toothbrush. So they bite, person bites down on the back of the toothbrush, mouth is ajar, and then you can go around to brush the teeth. And you'll find this is in NHS monitors. Okay. Um, so yeah, again, and again, if you want to release it, you stroke the jaw cheek area. Okay. So that is all from. It's called, like I said, it's all evidence based. No more fighting and biting during mouth care. Applying the theoretical constructs of perception to clinical practice, and that's all to do with mouth care. So hopefully, you found that helpful. I don't know if anyone's got any questions with regards to.
Brilliant. Thank you, Jane. That was incredibly
Yeah,
interesting. There's so much I took from that. So, plaque, first and foremost, obviously, we've all heard of it. We all read about it on all the tooth products. But obviously, it would make absolute sense that people with dementia are going to get more, but I didn't realize quite how much more. So that really kind of stood out for me. I think what you said about recovering from gingivitis, that actually just within a few days, potentially that bleeding can stop. I thought that was really, really interesting as well. And then I just love your tips, this stroking and all the different tips and tricks. Goodness, I wish I'd known half of this when my dad was alive because he really struggled. I was telling everybody earlier, obviously my dad lived with dementia. He eventually ended up with no teeth at all in his mouth because he had to have them all removed because they all rotted completely. He really didn't understand dentures, so that was a huge challenge for him as well. And he eventually just managed without any teeth at all, and just managed to, the gums kind of hardened up almost, and he was able to just kind of continue. He had still an amazing appetite in his care home, one of the best people with for an appetite. But yeah, I think that's
actually, Beth, can I just jump in there because I've just thought of something when you said dentures. So it's very common, okay, for people, they lose weight with dentures. They lose weight, dentures become loose. I mean, it's very, very common to have loose dentures. Now, just talking about people with dementia here now. Okay. So, mum's dad denture becomes loose. And then the first thing people think is, right, get a new denture made. Okay. So what happens is dentures is as people advance with dementia, what happens is they tend to lose the muscle tone around their lips and cheeks. So even if you have a new denture made, that denture is still going to flop about and become loose. So what we say, if someone has a loose denture, is first things first. Is I know it's very messy. Go out and get a load of Fixodent or denture fixative basically, rather than rush out and get a new denture made. Sorry, I just thought I'd put that in there because I just thought, well, that was linked to dementia. It's quite a common thing as well.
yeah. And my dad's face
Sorry, Beth.
definitely did shrink in, absolutely. And I think it's a huge challenge for people. And of course, with dementia, we often go back to earlier memories of earlier life, don't we? And simply, you didn't have dentures when you were 20. Most people don't. So actually, it's really difficult. Have you got any tips around how we can help people to get used to wearing dentures if they're not used to them, or is it just incredibly individual?
Well, the thing is, when someone has dementia, they've usually got their own, if they've got dentures, they've got dentures. It'll be unusual to have if dentures are removed, then to have dentures made for someone. I suppose in early stages of dementia, they may have, you know, it's again, as people advance with dementia, quite often they'll just stop wearing them. And it can be quite alarming for next of kin to see mum and dad without dentures, without teeth. But we usually say that if they don't want to wear them, we don't force the matter, basically. Yeah.
And
And then they, unfortunately, it tends to be like, if a lot of teeth are missing, yes, it can affect their chewing ability. But if you're struggling with that person for that, it can all become quite stressful, basically, which is what you don't want. So if someone with dementia is not, doesn't want to wear their dentures, then we don't force the issue, basically.
so
Yeah.
how would we look after the mouth of a person where we've no longer got teeth or dentures? Is it a similar brushing
Uh,
kind of routine to try
okay,
and keep
right.
them
Okay.
clean?
Yeah. So very, very popular, as then, very popular question. So if someone has no teeth, and they have no dentures, so obviously again, if they've sort of got dentures, you need to clean them. But if they don't have dentures, they've got no teeth. Common question that's asked is then what? How do we clean them out, basically? Well, remember what I said to you is plaque will stick to any hard surface. So they haven't got any teeth, they don't have any dentures. There's nothing hard for them to stick to. So yeah, sure, you may want to look in the mouth and make sure there's no pocketing of food, that kind of thing. You don't need to go around with a toothbrush and toothpaste and brush all the soft tissues, the palate, the cheek, the tongue. Just life care, okay? That's a completely different subject. A different webinar, really. And then we can talk about cleaning soft tissues and dried secretions and all that kind of thing. Just general day-to-day mouth care. I mean, I don't know. I mean, some people are into tongue scraping and palate. Like generally speaking, I would just stick to brushing teeth. But you don't you don't really need to clean all the soft tissues. You just need to make sure that mouth is, you don't need to clean it basically with a toothbrush and toothpaste.
Thank you.
There's
Thank
nothing
you
to
very
remove.
Right, I think I better get some of the questions in the chat because those were a couple of my burning ones. That was really interesting. So thank you very much. So first and foremost, there are lots of
Pleasure.
lovely thank yous in the chat. Now, Amanda's question is, do you have a link to the video for the University of Carolina, please? Now, I found this. I'm going to pop it in the chat, and I'm hoping Jane can tell us if it is in fact the right film or not. I did a bit of Google searching while you were talking. So I'm hoping I might have found the right thing.
I'm sure it is. I don't think there isn't that much out there, to be honest with you.
Mouth care without a battle. That's it. That's very popular on Google.
Are you trying to get the video up?
I can try and get the video up. Or do you want to click on the link
Oh,
I've
I
popped
thought that's what
in
we're
the chat?
waiting for. Okay, no, that's
Yeah,
fine.
and just tell me if that's I don't necessarily want to share it onto the webinar if it's the wrong thing.
Oh, right. Okay.
So,
So, what am I looking at? Sorry, Beth. I didn't realise.
oh yeah, in the chat I've popped a link, a
Oh, I'm in the
YouTube
chat.
link. Yeah,
Right. Okay. Sorry. I didn't realise. Yeah. Yeah.
brilliant. Thank you. Right, so that answers Amanda's question, and I
Oh,
suspect
sorry.
people might be interested in that as well. So, and
Oh,
then there's lots and oh,
hold on. What have I been and done?
you're still
Oh,
with me,
right.
so that's fine.
Okay.
Just
Yeah.
lots of lovely comments, people saying great tips to pass on. Thank you very much. Right, so we have a question. Could you clarify storing dentures in a dry pot? Have had some conflicting information from the hospital.
Great. Great. Right. Okay. Another excellent question. So there was a paper that came out in August 2022, which you can find on our website. So the dental profession used to advise soaking dentures in water. And the reason being is because we thought that if dentures were left dry, they would walk, they would move. So the dental profession has always put on there, storing damp. So at lockdown, I was doing some stuff and I got a bit of a telling off. You don't store them damp. You know what the bet, so store them dry. Okay, so the reason being is this. So basically, if you're storing a denture damp, in a warm environment, which invariably care homes generally are. I mean, or homes. If you're storing something in a warm, damp environment, you're going to get colonies of microorganisms multiplying in a damp environment. So they found that if you store it dry in a named pot, within an 8 hour period, most of those organisms have died. So, and you'll look, and an excellent place to look, to be honest with you, which again is all evidence based, is NHS Mouthcare Matters. Look on their resource. Okay, on their, I mean, we've got our own booklet, but theirs is it's like a Bible, and it's got anything you're unsure of. Go to NHS Mouthcare Matters and look it up there. But and you'll see it says there again, store dry in a named pot, and that's the reason for it. Lots of questions there.
Brilliant. Thank you very much. So I think I've found the website for this. Is it Health Education England?
Yeah.
Yeah. Okay. So let me pop that into the chat as well, because I would imagine that will be of interest to people. And of course, if you go on the Knowledge Oral Healthcare website, people are going to be able to contact you and they're going to be able to find your resources and all of that as well anyway, aren't they? So if there's
Yeah.
anything we don't
Just
signpost to in the
just
chat.
just no, notice that Lorraine's here, so she can point you into that. So, yeah, go on.
Brilliant. Thank you. So, next question is the only question I have is not using the name, the person's name, because of a fear reflection. Can you clarify this? Because a name can also be a trust approach, also because the person will think, oh, this person knows me, they're using my name, but also respect to use their names. I mean, it's going to be individual, isn't it? What you gave was
It's
generalized
it's
advice, but
it's
it's.
just being mindful. Yeah, it's just being mindful when you use the names. And again, it's something that I get asked a lot. I mean, I'm only telling you what these evidence-based, you know, the studies that I've done on this, and this is what they've come up with and what they found. So, I mean, I can't really comment on that, I'll be honest with you. But with their name, and I mean, of course, you use their name. But if you're doing something that they don't particularly like, maybe you might want to be a little bit more mindful about when you use their name. So that's all I can say with regards to that, really. Yeah, I was quite surprised it was on there, I'll be honest.
Yeah, and I can see the rationale behind both approaches, really. And I think, like I say on so many matters, that it is about knowing the person. It's about knowing what works with that individual. And there may be a particular name rather than their actual name that is better for them. I remember I was did some work in a care home, and people, I think I can't remember if it was somebody who was a reverend or a doctor or something like that, but he had a professional title and he didn't actually like being called by his actual name at all. He just liked his professional title. So again, it's so much of it is about knowing, I think, the individual and what works with them. And hopefully, with the tips you've given, people can get to a point where mouth care is not such a difficult thing to go through, and actually it becomes a much happier sort of experience for everybody. Lots of people saying they're going to signpost. So a question: people with no teeth, should they have an annual dental checkup, review of oral health anyway? Is that right? Advanced dementia, offer to see a dentist if stressed, would stop. Can only do what we can. So basically, I think the question there is, if you've got no teeth, do you still need to see a dentist, or is there now no point?
Um, you know, I mean, yeah, I mean, you can do. It's just what you're looking for if someone's got no teeth, is you're looking for lumps and bumps, basically. Anything unusual in the mouth, something that's been in the mouth, that's not healing, that's been there for 3 weeks or more. So like a sore. I mean, if they've got nothing in the mouth, I mean, why would they have a well, they could just sneeze, I guess. An ulcer that's not healing, something symptomless. The mouth is one of the fastest healing parts of the body. I don't know if you know that. The eyeball is the fastest healing part of the body, but generally the mouth heals very, very quickly. So yes, so that's considered a long time, 3 weeks. So having sort of that checked, I mean, that will literally be what a dentist would do. They would just literally shine a torch in the mouth and and look for anything under the tongue, and look for anything untoward. But anything that's not healing, then yeah, that needs to get flagged up.
What about looking for an actual dentist? So we know, particularly in the UK, a lot of
Oh
people have
God, don't.
challenges around finding a dentist.
This could be a
Now,
long
if you're,
conversation.
how long have you got? Um, Not only
Uh,
if you've got to try and find a dentist, but then finding a dentist who's actually going to understand people living with dementia. This is not going to be easy, is it? I mean, any tips around that, Jane?
yeah, it's not going to be easy. Well, first of all, well, if you're looking for an NHS dentist, I mean, there's a tab on our website, but the NHS, if you put in your postcode, it comes up with all the NHS dentists, but most of them closed their books. Um, so with regards to, actually, can I just sidetrack while we're on the subject of dentists? And again, I don't know how many of you guys are from a home, as in care home and home. So if you're in a care home, I just wanted to say that of the NHS registered NHS dentists, only 3% of the registered NHS dentists have a domiciliary contract. So actually trying to get a dentist into a home, a care home, domiciliary dentist is quite hard work. It can be. However, there are quite a few private domiciliary companies out there growing, and this is also applies to people living in, with if you're caring for someone in their own home or in your home. You've got these domiciliary dentists that are now, more and more of them are coming about. And one that I can think of is um, uh, Home Dental that are expanding like crazy. So that will probably be your easiest bet if you've got having difficulties getting someone to a dentist. Private dentists usually generally have no problem making appointments. With regards to dentists, are they dementia friendly? And Penny's on here, and she'll do a whole webinar on that probably. But um, you know, have the dentists been on dementia courses? Well, maybe one day it'll become mandatory where they have to, but not everyone. They don't always have the understanding, I'll be honest with you, and the time. So, it might be an idea to have a domiciliary dentist come into your actual home, possibly where they've had more training. Yeah, it's not always easy, I'll be honest with you. No, it can be quite tricky. And you might want to have that conversation when you make the telephone call. But it depends, obviously, on what degree, of dementia somebody's in, as well. So you just have to do a little bit of homework with regards to that. I think you'll find. Mm.
Thank you. Another question. Have you used the Dr. Barman autism brush? I have found this useful for individuals living
Yeah,
with dementia and their carers. Any views?
yeah, I should have put that on there, really, shouldn't I? Redo the redo the webinar again. So you've got the Dr. Barman's toothbrush, which I'm in South Africa at the moment. If I was back home, I'd reach down and want to show you what it looks like. So for those of you that don't know, a super brush or a Dr. Barman's toothbrush or a solid toothbrush, it's got three sides to it. So it's got, let's see if I can get my toothbrush. So it's got bristles on the outside and along the middle. So if you well, actually try and keep somebody independent. When they're brushing their teeth, they're brushing the outer, the inner surface, and the biting surface all in one go. So it's about 70. It's on our website actually. It's got links. We don't sell anything, but it's got recommended tools on our website. I don't know if you've got it on there, but it'll link you through. We can put it on the chat, can't you? It's about £7, I think. Anyway, so or if you're assisting someone with toothbrushing, again, it brushes the outer, the inner surface, and the biting surface all together. So it's an excellent toothbrush. Um, some of these companies, to be honest with you, if you're interested in them, if you reach out to them, they're quite good at sending samples.
Brilliant.
Yeah.
Thank you very much. And I'm really glad that, let me see who raised this. Michaela, thank you very much because it sounds like this is an excellent toothbrush. We do have the link to Jane's website in the chat as well. So let's move on then because we're running out of time and I can see we've got some more questions. So another one. I see a gent with advanced dementia. He is convinced he has something stuck between his teeth. He's had numerous trips to the dentist. Cleans teeth, nothing visible in between his teeth. He will poke around between his teeth. He's tried using a knife since removed, and toothpicks, etc. No dentist has any ideas of how to help. Now, you're not here to provide personal advice, so I will
Yeah, I don't know
clarify
how I'm going to
that
help them.
straight away. It's always tricky when we do really health-based webinars, but any sort of general ideas? Is there anything else that they could try?
Well, yeah, I don't know, maybe that's I mean, if a dentist has looked and they can't see anything, I mean, I wonder if it's a bite thing.
Or
Yeah,
it's just
I don't know. Without looking at the
sensory
person, it's very
concern.
difficult to
Yeah.
be honest. Yeah, I don't know.
I think a
Yeah.
return trip to the dentist possibly for another evaluation, but it may well be that the gentleman is just simply experiencing a sensory
Mm.
idea that he has that actually isn't necessarily how things actually are. Another question. A 360 toothbrush can sometimes help if the patient bites on the brush, it doesn't have the hard surface to bite on. Is this Dr. Barman's brush? It's another way of talking about that. No.
So, yeah, again, I don't have one here, but a 360 toothbrush it looks like a toilet brush. It looks like a loo brush. Okay, so it's bright and it's got bristles that go all the way around it, and it's very compact. So yeah, you can use it as a toothbrush. We tend to recommend it in end of life mouth care, to be honest. It's very good at retaining fluid, hydrating the mouth, and cleaning secretions. So you can brush the teeth and remove sticky secretions. And you basically roll it. You can roll it. We can use it as a toothbrush. You can also roll it and remove the sticky secretions. No, the bristles are nice and soft on it. It's definitely one that we recommend. We tend, like I say, we tend to recommend it in that end of life mouth care. With regards to if somebody clamps down on a toothbrush, I mean, whether it's 360 toothbrush or whether it's, I would probably get one from the town shop. It would be cheaper. I would probably get one that's a bit. I just went out literally in the just down the road and got some toothbrushes because I don't have any here. On me here, but yeah, this one isn't ideal. I just sort of want that so they can bite down on it. The 360 toothbrushes that are rounded barreled handle, but that would be my sort of preference anyway to do that.
Brilliant, thank you. My client has advanced dementia. We manage to brush her teeth at times, but with a struggle. She tends to swallow the toothpaste rather than spitting it out. Would consuming the fluoride toothpaste be bad for her? And how do you feel about fluoride-free toothpaste?
You know what? Unless you made toothpaste sandwiches, they ate it. They probably get the runs, to be honest, get diarrhea or something. But it's swallowed. You know, to be honest with you, with regards to, it doesn't matter if it gets swallowed. Toothpaste is kind of made to get swallowed to a degree anyway. Like we say, we want to keep the toothpaste in the mouth. It's going to get swallowed. When you're applying the toothpaste, you only use a tea-size amount. I mean, when they show you photos of, the toothpaste, loads of toothpaste on there. You don't need all of that on there. You only need a tea-size amount of toothpaste on there. If it gets swallowed, it gets swallowed. It's not a big deal. Yeah.
Thank you very much.
Um, yeah.
And then I think we've got one really good tip to finish with. So, regarding the man who believes there is something between his teeth, see a mental health nurse. He may be experiencing hallucinations or delusions. And I think chances are, if it has been evaluated by a dentist, unless the dentist has missed something, it probably is something to do with the gentleman's perception of himself and of his mouth. Jane, we've run out of time. Oh, already done that. Jeanette's saying, okay. I'm sorry. They had no answers either. I suspect this may be something
Yeah.
about what's happening with that gentleman in
Mm.
his
Sounds
brain.
like it.
But we've run out of time, Jane. I just want to say thank you so much. I think that has been incredibly informative for people, really practical, lots of really great stuff. The stroking and all the tips and tricks that you showed us, and I loved the demonstrations as well. I'm glad you didn't get me demonstrating, though. I'm very happy about that. But
Okay. Yeah.
thank you so much. Please do
Pleasure.
check out Jane's website. Lots of information on there as well. And
Yeah,
thank you
there is.
very much, Jane.
Yeah, pleasure. Thank you for
So
inviting me. Thank you.
let me take us all to our next webinar as we wrap up for today. So, our next webinar is from Skills for Care. It's entitled Supporting People to Live Well with Dementia, Practical Tools and Insights. It's on Monday, the 23rd of February, and it's available to book onto now. Do visit our webinars page. You've got the QR code there. Links will go into the chat as well. If you follow us on Eventbrite, you will find out about all our webinars as soon as they go live. We have lots more to go live. So they will hopefully be coming online in the next few weeks. So do follow us, do join us again on the 23rd of February. And until then, thank you very much and goodbye.